Greetings, everyone, and welcome to the Change of Shift podcast, where nursing meets the internet. I am your host, Sean Dent. The goal of this podcast is to solve problems, review topics, and share actionable information that encompasses the professional and personal lives of healthcare professionals and nurses. You can subscribe, download, and listen while we discuss current events, impactful stories, and invaluable lessons from the front lines of healthcare. Welcome, welcome, welcome. I want to thank all of my dedicated fans for showing up once again, and want to welcome all my new listeners for hanging out with us. Today's episode, interviewing a nurse named Wes, who is a clinical educator. He's going to talk to us today a little bit about professional development. We're going to talk about continuing education. Might even have a chat about what we call free open access nursing education. Out on the Twitterverse, it's a hashtag FOANed, F-O-A-N-E-D. Wes is a clinical educator for the emergency services department in a busy inner city emergency department. He's been a nurse just over 2.5 years. He graduated with his BSN in the spring of 2013, and he is starting Nurse Anesthesia school in the fall of this year, in August. You can find Wes out on the Twitterverse. His Twitter handle is BSN Graduate 2013, and on his Twitter profile he says that electrocardiography and airway management is cool. Wes, thanks for joining us.
Yes, sir. Thank you for having me. Proud to be here.
So you're actually having this interview while you're at work, man.
I am, sure enough. I'm I guess extra from what you've already talked about. My wife and I, we had our firstborn son. He's a little over 3 months old, so I'm kind of having to change my schedule around now where I can work days where mom's at home taking care of him and vice versa. So she's at home with little man right now. She's also a nurse, so she's off this weekend and she's taking care of him. So this past week I wasn't able to work as much because I was at home while she was at work and all that kind of fun stuff. So I decided I'd come in today and get some office work done for a little while and chat with you for a while.
Well, congratulations. Is this your first child?
It is. He's the first child, first grandchild. He's spoiled already. So yeah, first child for both of us. So he's a cool little guy. Exciting,
and from what I'm told, a world-changing event.
Very much. I'm still surprised how productive I can be with such little amounts of sleep. So I'm adjusting well, though.
Well, you know, our nursing brothers and sisters out there would simply say that that's just par for the course when it comes to being a nurse.
That's it. Yeah. So, I've realized that's the new way of living now.
If you're interested in having a child, become a nurse so you can get ready for the lack of sleep.
Yeah. Oddly enough, my wife, on her unit that she works in, there were I think they had like 38, 39, 40 something staff. There were eight ladies up there that were pregnant at the same time. So I don't know what was in the water, but it was a pretty unique situation.
You know, and that's the sidebar that I'd love to explore, is that seems to be a very common occurrence, and I'm saying that from personal experience, but it sounds like it's happened in other areas of the world. That I've worked in multiple hospitals in multiple units, and once one family gets pregnant, it seems to be some sort of a domino effect. And I'm wondering if it has to do with the pheromones, or
I don't know.
Maybe we should do a pilot study. What do you think?
Right. Yeah. Retrospective study and see what happens.
All right. Well, Wes, I've given the audience a little bit about yourself, but I want you to give us a little bit more here. Fill in the blanks. What can you tell us that we don't already know that our listeners would like to know? What was Wes before he was a nurse?
Well, I guess just a little bit about me and my background. Before nursing school, going back way like pre-teen years, I guess I always had some sort of inclination that I knew I would be in the healthcare field. I know this is going to sound odd, but when I was 6, 7, 8 years old and I would stay at my grandmother's house, during the week or after school when my parents were at work, I didn't go to daycare or whatever, but my grandmother would always record trauma life in the ER for me. And I'm talking 6, 7, 8 years old, and I was so fascinated with it. Of course, I didn't know the terminology or anything. anything like that, obviously. But that right then and there, my grandmother always said, she was like, yeah, one day you're going to be doing this stuff. And sure enough, that's what happened. I had actually planned to go to med school, was my plan right out of high school. I had surgery when I was 12 years old, a little eye surgery to correct some sort of little muscular issue that I had in one of my eyes. And I knew anesthesia. I was like, wow, this is awesome that they actually put me out and I had no pain, no recollection of the events. And I got very intrigued with that and the chemistry and the science of it. And my whole goal was to go to med school. And then, long story short, I got accepted into an undergraduate program. I was going to do a pre-med major down at one of the big universities, big medical centers down here in the Southeast. And got to do some shadowing. And, like I said, I was interested in anesthesia. So I did some shadowing with one of the MDAs and got to see kind of firsthand that really the CRNAs are the ones that do most of the hands-on work. And then the MDAs kind of just go around and supervise. So I was like, well, let me change this up a little bit. I said, I want to do the hands-on. I want to be the one doing the work. So changed my route, went nursing school, and then, decided during my preceptorship, I wanted to try my hand in the ER. So I worked at, I got to do my preceptorship in actually the largest emergency department here in the state, level 1 trauma, all that kind of fun stuff, and got very intrigued by it. And right then and there, I more or less gave up on the chance of ever getting into anesthesia school just because, you got to have the, quote, ICU experience to be able to get into it. So decided I wanted to work ER. I've been doing that for, like I said, about 2.5 years now, coming up on 3 years in June. And then one thing led to the next. The next thing I know, I got an interview for school, and now I'm getting to go. I'm one of the few ER nurses that have ever gotten into the program, so they tell me.
That's awesome.
Yeah,
I think
looking very much forward to it.
You unfortunately fit into that cookie cutter stereotypical guy that enters the nursing profession that just trajectory goes right through the high intensity adrenaline rush type of environment.
Yes,
and
very much.
Going right into anesthesia school. So I'm here to tell you that whole got to have ICU experience thing is being kind of pushed to the wayside these days.
Yeah, the program director, I actually went and had a sit-down talk with her. I said, look, I want to give, I'm not an ICU nurse. I don't call myself an ICU nurse. I am solely an emergency room nurse. And I said, look, here's my resume. Here's my, my CV. Here's what I do, blah, blah, blah. I laid all that out for her. Here's my GPA. She looked at it and she said, okay, well, you've got your critical care certification. Tell me what you do in the department to, why should I be able to, offer you at least a chance to apply? And, it basically came down to once I showed her the stuff that I'm actually teaching here in the department and the hands-on experience I've got with these incredibly sick patient population, that she was like, yeah, sure, you can apply. And I got an early interview. And then actually they gave me admission into the program the day that I interviewed for that year, which was started like 2 weeks later, which, obviously I wasn't going to be able to do. So I said, yeah, let me just do the regular admission like what I had applied for. So instead of starting August 2015 rather, I'm starting August 16. So looking very much forward to that.
So you decided to plan having a baby before going to school?
Well, no, we were actually pregnant then, and the whole interview that I went to was actually it was for an early decision for the following year, and I guess they just so happened to have a seat open in the class that was just getting ready to start, and they're like, hey, if you want it, you can have it. And I was like, well, that's awesome, thank you. That's very humbling, but I've got some other things going on right now, so I need to put it off, and wait till the regular cycle next year. So
it's awesome.
It's gonna be great for me and my family.
Yeah, you're gonna have a busy next couple of years.
Yeah, sure enough. But in the long run, it's going to pay off, no doubt.
Yeah. So I had a set of questions to ask you that I emailed you, but I'm already going to veer off course here and ask you something that happens commonly and, stereotypical. We're going to jump down that hole. You and I, men in nursing, we are the minority. Not sure if you saw the articles that were shared recently about the men in nursing and the minority and the disparities and things of that nature. But I want to speak to you about, you knew from the beginning that you wanted the high adrenaline stuff. You wanted the trauma, life in the ER stuff, and you had thought of and respected and had aspirations of going into anesthesia, which is even higher octane for those of you who don't understand anesthesia. What I want to know is, how did you get through nursing school? Because nursing school is not high octane. Nursing school is bland, it's standard, it's basic, and dare I say, for those of us who are willing to admit it, boring.
Yeah, very much. That's a good way to put it.
How did you get through it without saying, this is crap, I'm quitting?
Well, for me, and I guess this goes back to even earlier years, I've always been very inquisitive about things, and I want to know the why and the how behind. Don't just tell me something, make me understand it. So why don't you say, our curriculum was kind of, I guess, boring and very bland. It just barely scratches the surface. I was always one of these that I look, if I've got my study topic, I don't want to know the top of it. I want to know it from top to bottom. I still say, and for people that check out my BSN students Twitter app or Twitter handle, I always preaching about how important pathophysiology is, and I feel like pathophysiology, if you truly understand the underlying issue of the disease, you know how to treat it. You can take out every other class in nursing school. I think pathophysiology is the class that you learn the medical disease, you know how to treat it. There's no intricacies about it. It's straightforward. So even now today, my pathophysiology book, it didn't stay closed more than maybe a week at a time, because I'm always open and wanting to learn more. And that's just, I guess, a internal drive, motivating factor for me is just to be the best that I can be. And I want to learn everything and know it, top to bottom, and, that sort of thing. So
how did you get through the bed baths and learning how to give a sub-Q injection and going through the part of nursing that you knew in the back of your mind you're not going to be doing?
Well, at that time, I don't guess I necessarily didn't know that I wanted. I knew what I wanted to do long term. I wasn't sure exactly, what the course was that would lead me to that. Because, most they told us in school, it's best for new grads to get a med surg job where you can kind of get a good feel of everything before you start trying to go into these specialties. And, so who knew what I was going to actually do? And my cards just happened to lay out the way they did for me, and everything worked out perfectly. I couldn't have rewritten it any better. But, the fluff classes, the things that you've got to do in school, that's just part of it. You get through the curriculum and then you get on to the real business of it.
I only ask you that question because a lot of wannabe nurses, a lot of first-year nurses, a lot of prereq students, and this is both men and women, not just men. I will say it's mostly the guys. That's their struggle. That's their stress. That's their biggest complaint, is that I want to get to the exciting stuff. I want to see the blood and the guts. I want to see, sticking tubes in orifices that shouldn't have a tube in them. I want to see all the cool equipment that we have. And you hit the nail on the head, is that you have to know the why. If you don't know the why, you're not going to know the how. And you have to know how things are normal before you can even address the abnormal. And that is preached from day one up till now. I've been an advanced practice nurse, and we still preach that to this day to everybody that we speak to, is that you have to know your patho. You have to know the why. If you don't know the why, then you should not be here.
Exactly. And unfortunately, and I don't think that it's just a problem where I'm at. It's globally. I think complacency is such a big part of the world that we live in as nurses, and that's why I'm always trying to advocate for continuing education, and don't be a mediocre nurse. There's nothing wrong with coming in and doing your 12 hours and going home, but if you're just able to understand things a little better and get a better understanding of the concepts behind each illness or whatever the case may be, it's going to make you such a more well-rounded practitioner. So
I love
that's
it.
kind of my spill on that.
There's a nurse, I don't know if you know John Hawes. He He has
I saw
nursing.com. He did an Instagram post and a blog post about his nursing team, his dream team, and just in the short 20 minutes we've been talking, you'd be on my dream team, my friend.
Good. I'm proud to hear it.
I love the passion. So let's talk about your job. Clinical Nurse Educator in a busy emergency department. So tell us about it.
Well, my job, it's different depending on the day I'm here. The big part of my job really is the informal learning, which is doing orientation for new hires. I have to set up all their schedules, go to all their orientation meetings for their first week that they're here, and all the boring formalities that you have to get out of the way, like in any other hospital orientation. And then I set up all their schedules with their preceptors that they'll have down here, and all that. That's part of the job. That's all fun. But what I really enjoy is the formal education process of it. And once a month at least, I do an in-service for the department, and I do it based on what my staff. I've got a little box that sits on my outside my door that is essentially ask for feedback. If there's something you're lacking or that you need some insight on, a little re-education, drop me a note in here, and I basically pull one of them out. I may get 8 or 10 in a month. I pull it out, and I'm like, okay, well, this is what we'll in-service on this month. So I do it 1 day during the or 2 days during the week, and then I come in on a weekend to get the weekend staff as well and get that. And then outside of that, I do even more formal education in the format of lecturing. I've got 3 or 4 different lectures that I present. I've actually got a couple coming up in the next couple of weeks. One entitled Airway and Ventilator Management for the Emergency Nurse, and then caring for the patient with acute coronary syndrome and recognizing patterns, ischemic patterns on 12 leads. So like you mentioned earlier, in my bio on Twitter, I talk about how much I enjoy airway management and electrocardiography. That's 2 things I found out really early on. First semester of nursing school, referencing pathophysiology again, that those are 2 intricate things that I really, really like to dive into and learn a lot about. So I figure now that I've learned a lot about it, I might as well share it with other people and see if I can't, benefit somebody else to help somebody patient in the long run. So I do enjoy my job very much. It gives me I guess a very broad spectrum of things that I can do. So
it's going to be a wonderful segue for when you do finally graduate and become a CRNA, a nurse anesthetist, because you need to be an expert at airway management. So that's awesome. Yeah. You have found the role you were meant to have.
Yes, I enjoy it very much. Good. So I've got it cracks me up a little bit whenever I have these classes that people, I publish them on different social media sites, as well as email them to other clinical educators in hospitals around the state. And I'll have people come, from 50, 60, 70 miles away to a class that don't know who I am. And, these people, these experienced nurses, been nurses 15, 20 years, they come in and they see that I'm the instructor and I'm 24 years old. And they're like, there's no way that this kid knows what he's talking about. And then at the end of it, they're like, oh, wow, you actually do understand. I had one group of people, the last airway class I did, she actually tried to convince me to come to their hospital, which is about a 55 or 60 mile drive, to teach the class to their entire emergency department. And I was like, well, maybe one day, but right now my hands are kind of tied with other things. But I enjoy the formal education part of it. I love it. So
another segue is that I promote that all nurses should have a blog, and I think that you should have a blog, and that has a repository of all of this wonderful information. And you could either make it free or you could charge people an entrance fee or something. But I have a feeling that you would have a lot of people on the internet that would love to find your website.
That would be that's something I've actually thought about it, but it seems like so much other stuff going on. That's just one other thing to have to keep up with. So especially now with my little man at home, my priorities have changed a lot in the last 3 months since I've had
So just in case we're recording this, if it got cut off, I was mentioning to Wes that with his passion for ECG and the 12 lead and his passion for airway management and the fact that he he has quite the reputation with education that he should start a blog or a website and start passing on this wonderful information to anyone that's interested. So we'll see. Maybe I'll keep hounding him. We'll see if he gets to it.
Right now, that's what I use my Twitter for, I guess.
He has that excuse of a newborn. We'll go ahead and let him have that one for a while.
See how long I can ride with that.
Yeah, and then it'll be the I'm a new student excuse. So.
Well, yeah, for sure. I'll probably be on the away for a while on Twitter whenever that starts.
Yeah. And if you've talked to anybody who's gone through any kind of advanced practice programs, you don't have a life.
Right.
All right. So you have such a wonderful passion for your job and for the intent of your job, but what do you find the most challenging part about your role? And what I mean by challenging is that not everybody loves their job 100%. There are parts of the job that you wish you could fix or eliminate, or parts of your job that, let's be cliche, that get under your skin. And what about your job? What do you find most challenging?
There's always going to be the negative people that you work with that no matter what happens, no matter what the circumstances are, they're always just going to be that negative entity that's around you. That can segue into any kind of career or job for that matter. But the negative people and the naysayers that nag and carry on, that's always, something to deal with. But as far as having a true negative with my position in and of itself, I really don't have much to give you there. I know that's kind of a bad answer, but I guess I'm not happy with my position, and I don't have a whole lot to complain about.
I wouldn't call that bad. I would call that a source of jealousy for many people.
Yes. I can say that my working environment is different than, and I'm talking about even as a staff nurse, not as my education role. I still work as a staff nurse occasionally, try to do at least a shift or two a month. But I would say that our staffing here at this particular facility is a much greater education level as far as continuing education. I work with a lot of good certified nurses, and we also have good ratios here, patient to nurse ratios, which makes a lot of difference.
That's awesome. I would love to get your insight on having a good managerial team, but we're going to move on to this next question here because you kind of segued into it already. Is that you mentioned that your staff and a lot of your nurses have certifications, have advanced certifications. Tell me a little bit about that. Why in the world would a nurse who just became one, first year, second year, third year, heck, they've been doing it for a while, 5, 6, 7 years. Why in the world do I need a certification?
Yeah. Well, for everybody, it's different. For me personally, it was for the self-satisfaction, just to know that I do possess the knowledge base to be I guess, an expert level in the field of emergency care. For other people, some places offer financial contributions and such, so it's basically let me see what I can do to make more money, which of course, who's going to turn that down? But again, for me, it's just the self-satisfaction and my knowing in my mind that I have this distinguished credential that not everybody has, that a select few of us emergency nurses carry. It's just a self-motivator and just from me, a way for me to show my patients and my other community that I'm good at what I do.
Oh, come on. You're a clinical educator. You have the job to actually have to teach others. How can you convince a new nurse that shows up on your unit that they need to have their certification in emergency nursing?
Well, to provide better care overall and just be the best provider you can be. I've actually got two new nurses in orientation now, both of which have been licensed for less than a year, and they are both extremely eager to learn. They're I want to do TNCC and ENPC as quick as I can, and they ask me, what about this CEN course that you help with and all this other kind of stuff, and it's really a breath of fresh air to get that eager personality that comes in, because I do work with a good handful of more experienced older nurses. Like I say, they're complacent. Not to say that that's a bad thing. They're excellent nurses, but they're set in their ways. They have no desire to go forward. But certification is just one of those things that I feel like is again just such a self-satisfier, and it's going to make you a better provider in general. If nothing else, it just gives you the mentality that you know what you're doing. So,
I mean, you love to utilize research. So
very much.
if I'm not mistaken, there's evidence out there that proves that the nursing care provided by nurses who attain, maintain, and acquire some level of advanced certification actually provide better and safer care.
Right, yeah. ENA actually has a little post on that, their stance or whatever about certifications. And I can't remember the exact numbers and all the research behind it, but it does essentially go to the point that you just said, that there is a higher quality care that's provided by certified nurses.
I mean, I would hope that most or the majority of individuals who pursue our profession are out to care for and to improve the lives of the patients that they care for. And what better way to what better way to ensure that you're given the very best care by attaining a certification of that kind. I was one of those eager nurses back in the day when I graduated and got my licensure. I was already asking about the CCRN certification.
That was a beast, by the way.
Even before I got off of my new grad orientation, I was already asking and already researching on the AACN website, how many hours do I have to have before I'm allowed to apply, and when can I take it? I still remember that exam to this day. That was one of the hardest exams I ever studied for.
I studied pretty well for CCRN for, I guess, probably about 2 months, pretty in-depth, using their content outline and all. And I took the exam, and by the time, I don't know how it was when you took it. I'm sure it's the same now, but I took it at a testing center where I found out, 30 seconds after I hit submit, I went to the printer and it, gave me a certificate of a pass or a fail. And the whole time I was walking up, I was like, goodness gracious, that could have went either way. And, of course, it was a breath of fresh air and a sigh of relief whenever I saw the big congratulations at the top of it. So that was good. It was probably my proudest credential that I've got for sure, just because I'm not truly what you consider a critical care nurse, but I've got the knowledge base to be able to prove that I am.
I took that exam almost 10 years ago. I still have the printout.
There we go.
I still have the printout from when you walk from the back of the room to the front of the room, and you have the individual at the front desk who gives you the straight-faced, no emotion.
Yes, 100% straight.
Hand you the paper so that you can either in that split second say to yourself, oh my God, I just wasted all that time and I failed, or you turn the paper over and realize that you passed. So yeah, the CCRN was the first exam I took after my NCLEX that was as high and was, I think, maybe just me personally, I think was more intense for me than my state licensure was.
Right.
Sure, the NCLEX is. Here's a question for you. We're going off topic again. You're a clinical educator. Maybe you can answer this for me, because I'd like to locate the individual that actually released the information to basic nursing students about the whole 75-question basic thing. Where did that come from? Between you and me, they deserve throat punched.
Right. Yeah. What entails a quote basic nursing? I mean, my goodness.
I know that when I started my nursing program, they tell you from the start that you can know with a great bit of certainty if you take 75 questions and the computer shuts off, you've passed. But if
either that or you did horribly.
Yeah. Or you have more than 75 questions and there's a likelihood you might not have passed. And
right.
I was one of those individuals that the computer did not shut off at 75 questions. So, yeah, my stress level was a little high for that day. But I don't know where you live, but you could actually go online in 48 hours and find out your results.
Yeah. I actually found out within, I think, 24 hours. They told us some trick where if within 24 hours, if you tried to resubmit an application, like to retake it, if it would let you redo it, that you failed and it was going to let you retake it. But if you got some sort of error message that you're not able to retake the exam, then you pass. I don't know what the percentage of that's always 100% accurate, but it worked for me. So
I never heard that before. So in my state, I'm from the east side here, but you could pay an extra fee, and it was a nominal fee, maybe $10-$20, and you could go look and see within 48 hours if your name was on the list to be issued a license number.
Oh, nice. Yes.
So you
of
didn't
course, everybody's going to pay that because they want to know.
Who doesn't? I mean, come on. And that's a perfect way for the state to make money.
To make a little extra money.
Jeez, you imagine how many students take that exam on a daily basis, and you multiply that by that fee. You're already spending $200, $250 on the NCLEX exam. What's another $30 to know in 2 days if you pass? When I took the exam, you could, when I was in nursing school, you could actually apply for a temporary license so that you could actually start practicing as a new grad immediately upon graduation.
Same here.
Okay.
That's how I was. I got my temp license and was working as a quote RN before I actually even took NCLEX.
Yeah, me too. I think I worked for almost a month before I took my exam.
Yeah, and just as a side note, kind of a unique thing, I actually found out that I passed NCLEX on my birthday, so that was cool.
Oh, geez.
That was a good.
Forget that.
Never. I was at work. It was like 10 in the morning. I went in there and checked it, and I saw my name in the registry, and I was like, awesome. That's a good feeling right there. So good way to turn 21.
Nice. You had a double reason to go out and celebrate that night.
There we go. Exactly.
I think every nurse out there can tell you where they were, what they were doing, and maybe even know what the smell in the air was when they found out that they passed their NCLEX. Because I can tell you exactly where I was and what I was doing. So it's a very it's a life-changing event.
Certainly.
It's the moment you cross that line and you cross the bridge. So, all right. Like I said, I always end up getting off topic.
Hey, that's all good. Makes for good conversation.
So the last topic I want to discuss is free open access to medical or nursing education. Now, for those of my listeners who have absolutely no idea what I'm talking about, I believe, and I could be mistaken, I'm hoping maybe Wes can clarify this for me, is that free open access medical education has been around the internet for a number of years. When I first was exposed to it, it was through another blog and another website called Life in the Fast Lane.
Oh, I love
Life in the Fast Lane was by Sansurf. Was one of the first websites that I remember reading the concept of free open access medical education. And then maybe a year ago, maybe 2 years ago, was the first time I saw free open access nursing education, and it was through another blog and website, nurse who runs the website called The Nurse Path by Ian. He's a nurse in Australia. He's been on Twitter as long as I have, which is when it first existed back in 05, 06. And that was when I first learned of free open access medical, free open access nursing education. How, and please clarify what you can and explain to my listeners and to me what the heck that is.
That's really kind of a good question, I guess, not just ask me, but for other, whoever's listening. I wasn't really exposed to it too awful much until maybe, I would say maybe a year ago when I actually started, maybe a little longer than that, maybe a year and a half ago when I really started tweeting more educational things versus just talking about my day-to-day, I saw this today, this is what happened, this is
what I'm eating for dinner.
Right, yeah, that's precisely. But then I got to actually started with the free open access, the medical when you speak up there, and of course there's several great, Mike Abernathy, Flight Doc 1 up at Wisconsin, and always post some awesome topics with the hashtag FOANed, and then EMS1 ECG trainer, all that kind of fun stuff. But I started looking at that.
You're going to have to send me those links, or at least share that information so that I can post that on the show notes and the podcast.
Yeah, those are. I've got a couple. I've got about 5 specific Twitter accounts and websites that I actually look at pretty much daily with new updates and stuff, and new trends and all this stuff. Imprint is probably my favorite one. Dr. Scott Weingart. Most everybody knows him. So.
Well, for those of us who have been around a while now, Scott is one of the few that actually can keep my attention.
Yes, very much so. He's got a good way. I love listening to his podcasts and his videos. It
was one of the first podcasts I ever listened to that was medical based.
Right. Good, excellent to listen to. Excellent topics to discuss.
You'll have to send me those links or those handles, and I'll definitely put those.
I will.
Put that in the podcast show notes so that everybody can find them.
Yeah. But back to what you actually asked about, the FOANed. I wasn't very exposed to them until about a year and a half ago, and then actually I don't remember how I saw it to begin with. And of course, the little hyperlink to it intrigued me, so I looked at it, and the next thing I know, I was like, wow, all of these are high intelligent and high intellectual different conversations that these people are having that can, really give you a way to learn and understand different concepts. And so next thing I know, I'm getting deeper and deeper, and then here we go. I've gotten into all these blogs, and I'm learning stuff that I found, like you said, it's free. It's free open access, so it's definitely an excellent way to find information on pretty much any topic you can want to do in the medical field.
Yes.
Without having to go to the bookstore and buy, the EKG for dummies or whatever else. You don't have to spend a ton of money on it.
I actually think I still have that book.
I won't judge you for that.
Yeah, I think I have something like that. So, I believe that the hashtag FOANed and FOANed, they eliminate the WebMD effect. There you go. Good way to put it. To be able to rely on the information given as being valid and reliable for those of you who have forgot everything you were taught for evidence-based practice, validity and reliability are actually quite important. So what you read on the internet is not always true, and what you read on the internet is sometimes horribly biased, so it's basically opinionated. I think that FOANed, free open access education, both medical and nursing, eliminates that. It provides you with sound evidence-based practice information to make a educated and informed decision about whatever the topic is that you're interested in or what they're talking about. And it seems to be very up to date with all these trends. It's very current compared to, for those of us that remember having to go do, a Cochrane search and things like that. And your latest, the most concurrent piece of evidence that you have is from 2005, 2000. So, I wonder, would you recommend to a nursing student or just a nurse, or let's go with nursing student, would you recommend any of the nursing students who are looking to do research for an evidence-based practice project, do you think using those two hashtags would be good advice, bad advice?
Oh, yeah. I think it's certainly beneficial. Now, of course, it's going to depend on what source you get it from, because anybody can go type up something and throw a hashtag behind it and it be, completely, erroneous information. But if you're getting it from a good accredited source that's got a good background of understanding what's going on, take, for instance, the whole revert trial. I had not heard about revert. We're talking about converting SVTs until maybe 6-8 months ago, and I found a video from hashtag FOANed. Used it probably 24 times here in the ER when we, not having to do give adenosine to these patients now, which we know can have inadvertent effects depending on their underlying cardiac pathology that they've got. That was just kind of a side note. I had to throw that in there, but
no, by all means, please.
Yeah.
And that particular piece of research is fairly new. So can you give my audience the quick 2-sentence version of that?
Sure, for a revert trial. Yeah, so essentially with revert, these patients that are in SVT, where generally the go-to is, have them bear down and get some vagovasal stimulation to try to decrease the sympathetic responses of the heart rate. And if not, you go straight block that SA node and reset the heart per se. But with the revert, what it entails is essentially having the patient sit up to begin with, blow into a 10 or 20 cc syringe to get it enough, to build up enough intrathoracic pressure to somewhat decrease your central venous pressure, your right-sided filling chambers pressure. And then after about 10 to 15 seconds, you want to lay them flat back and raise their legs up. And I want to say that based on what I've read last, it's got like a 66% success rate or something. I mean, it's pretty good numbers based on how many 66% is pretty solid for having to do a non-invasive treatment for SVT.
Yeah. So for those of you working in the ER or anywhere in the critical care arena, I'd be curious to see if anyone's actually done it and did it work. I know that
we've done it here. Like I said, about half of probably probably at least a dozen times now in the past 2 or 3 months. I actually shared the information with a couple of my physicians. Our medical director was like, "Hey, come on, let's watch these videos. Let's do this and let's try it as a treatment modality." And lo and behold, that's our first go-to thing now for anybody with SVT before we even think about putting an IV in them, or not necessarily putting an IV in them before we think about giving any adenosine.
Yeah, I mean, of course, we're talking about the patient's condition as well. So
right,
there's a lot of disqualifying factors there.
Mm-hmm. Yeah. For the
you don't want to do that with a level 1 trauma.
Yeah, true that.
So that's where that whole critical thinking comes into play.
Yes. Critical thinking. That's where you got to use your brain a little bit.
Yeah, you can't just go by a textbook or a recipe. Who would have thunk it? All right, so, I had 2 extra questions here that I wanted to, and these are maybe just personal interest, but 2 things that I want to discuss or get your opinion on. The first one, and I think I saw it, either you shared it or one of the other ED nurses I know might have shared it, and I don't even know if it was a hashtag, a free open access hashtag, but what are your thoughts on these devices that actually do CPR for you?
Yeah, so you're talking about a Lucas machine, I'm sure. I shared something about that about 2 weeks ago after watching Night Watch. For anybody that doesn't watch Night Watch, you need to get on that A&E Thursday nights. I have to throw a little blurb into them. That's an awesome show. Yeah. But yeah, for the Lucas machine, for me, and I hadn't already discussed it, but CPR in the field is something that I actually work with our rural regional EMS systems to try to increase our rates of survival. Now, the Lucas machine, for those of you that don't know what it is, it's a hands-off CPR. It's essentially a device that goes onto the chest and it kind of velcros around behind the patient, and it does the compressions for you, so it frees up a provider's hands to do, whether it be, ventilate, intubate a patient, put an IV in to push ACLS drugs, all that kind of thing. They are very expensive, which of course is the pushback for why they're not readily available for everybody. But the numbers, the last numbers that I saw probably 3 months ago from Physio Control, who's the one that makes it, that the return of spontaneous circulation during transport while using a Lucas machine were about 56% greater than when trying to do hands-only CPR. Because, you got to think, when people are moving patients, you've got to move them to the stretcher. You move the stretcher to the ambulance. When you get to the ambulance bay, you've got to unload the patient. There's too much time for hands-off CPR. And we all know that within about 5 to 10 seconds without CPR, your cerebral perfusion pressure drops like a rock. So you're basically doing nothing for that patient. It takes you another 10 or 20 seconds to actually get the perfusion back up to the brain. So if you do resuscitate these patients that have had limited hands-on CPR, they're essentially going to have brain death or some kind of neurological deficit. So I'm a huge proponent for having the Lucas machine. In the past 3 months since I've actually done some of the studies with our regional EMS companies, we've got 3 of them that have been purchased for different EMS. The ones that have historically had the most runs or have had the most calls for cardiac arrest. So they actually have those on their units now, which was an awesome thing. I was glad to be a part of.
Awesome. All right. So always finish out my interviews with a couple off-topic and fun questions here. These are what I like to call rapid-fire questions. So
okay.
you don't get a chance to think about it. You just have to answer. Don't worry. It's not there. They're just this is for fun. So put your educator hat down.
It's done. It's off.
All right. So 5 questions, rapid fire. First question: what's your favorite color?
Red.
Your favorite movie?
Wow, that is a tough one. I've got a lot of those. I guess I would have to say A Christmas Story.
Nice.
You'll shoot your eye out,
Nice.
That's one of those TBS, it comes on 24 hours. I watch
my
it 2 or 3
favorite day of
times.
the year.
Yes, sir.
Number 3, your favorite food?
I like Italian food in general. How about that?
Okay. Now, this one is probably going to be a little biased on it, but I'll ask it anyway.
Okay.
If you had to choose between 2 types of shoes, the clog or your traditional kind of shoes to work with?
Me personally, I wear traditional tennis shoe at work, but I have a couple of times tried on the clog style Danskos, and they're very comfortable. But I can't get over just the fact that I'm not. And nothing against the women here, but they just look so feminine. I just can't bring myself to wear them. So I don't know. There's just something about it. It's just I can't.
The backlash is coming.
God, like I said, nothing against it. It's just something that it is what it is.
And the last question, and this is always an interesting answer from most of my guests, is what is your most favorite piece of nursing equipment?
It's probably going to be pretty generic from an ER nurse, but you can do a lot of things with an IV catheter. So that's what I'm going to go with. You can access a vein. You can decompress a pneumothorax. We can use it for, what else do we do random things for? If you've got a subuncle hematoma, you can bleed that thing out of a toenail real quick. You can do a lot of things with
So you're telling me that your staff at your ED, they all carry needles around with them?
Oh yeah, I've got 1, 2, 3. I've got 5 in my pocket right now.
That's awesome.
I've got a couple of 20s, 18, a 16, and a 14 right in my side pocket.
All right, final question, and this is probably for my benefit and for my audience's benefit here. If you could suggest or recommend a future guest to come on to the show, who would you recommend?
That would be hard to narrow it down to one. I'll have to say, do I have to pick just one?
Well, hey, if you got a number of suggestions, I'll be glad to take it.
If you could get... there's a couple here. I'll give you 3 of them. Of course, we already talked about Dr. Weingart, Scott Weingart, who is pretty well renowned in the medical field, especially on Twitter and, his MCRIT website. He's awesome. A good expert on pretty much anything emergency, critical care, resuscitation, that sort of thing. But also Mike Abernathy, who's a flight physician, University of Wisconsin. His handle is at FLT.Doc1, Flight Doc 1. Always tweeting good information on the HEMS or helicopter EMS side of the specialty and emergency care. And also Eric Bauer. For you that don't know him, he's the author and blogger behind Flight Bridge ED. He's an educator at Erlanger Life Force here in Chattanooga, Tennessee. He's got an awesome website. He puts some pretty good podcasts out. His podcasts aren't always medical based. They may be talking about a football game or something, just to kind of break up the monotony a little bit. But those are three of my favorite guys to go and look and listen to the things they have to say. So
I have written down all 3 of their names.
Yeah.
So Wes, we know about your Twitter handle. You're at the BSN Graduate 2013. Are you anywhere else on the internet? Any other social media sites that, if anyone was looking for you, where they could find you?
Other than that, I've got my nursing school Twitter. I still dabble with it occasionally, and it's at BSN Students. But other than that, that's the only ones that I've got.
Awesome. For all my loyal fans, thank you again for listening in, and once again, a fond and awesome welcome to all my first-time listeners. If you like what you heard, be sure to tell somebody. For those of you who did not catch last week's episode, I talked about 11 tips for what I like to call fitness hacks for the nurse out there who can improve their health, improve their fitness while they are on shift, while they're on the job. Some of the tips that I mentioned were taking the stairs, planning ahead with your meals, and, of course, having a plan. You can't out-exercise a bad diet, and there's no bargaining in weight loss. You've been listening to the Change of Shift podcast, where nursing meets the internet. The goal of the podcast is to solve problems, review topics, and share actionable information that encompasses the professional and personal lives of healthcare professionals and nurses. Subscribe, download, and listen while we discuss current events, impactful stories, and invaluable lessons from the front lines of healthcare. You can find the Change of Shift podcast out on the internet at thechangeofshift.com. I have been your host, Sean Dent. You can find me at SeanDent.com, a website that is the social media vault for all nurses across their career spectrum who are seeking guidance on how to succeed. You can find all of my contact information as well as all of my social media accounts. I'm hoping that we can connect and that you'll send me a message. Let me know, how was the show? Wes, thank you for joining us. Thank you for educating us. It's been very enlightening, and I'm hoping that our audience will take maybe just that extra step to promote and or maybe advance their education in some way. You've been a shining example of what can be done and what could be done if you just put forth just a little bit of effort.
That's all it takes, a little go-getter mentality.
Absolutely. I wish you luck with the newborn. You're going to have your hands full. And,
yes, very much.
I'd like to get you back on the show to get your experiences on being a student again. Maybe when you have time, maybe over Christmas break this coming fall.
Right.
We could get you back on the show to talk about your first or second semester on how it is being a student nurse anesthetist. So
I'd be happy to. Just you know how to reach out to me.
Oh, yeah. As always, I'd like to finish the show by saying, make sure you check your own pulse first. Thanks, everyone.